So one thing I have to admit that I love about Donald Trump is that he will just come out and tell you the quiet part. And he will just scream it out loud, and he will tell you what corporate Democrats and Republican sycophants don't want you to know, but like is actually happening. Like he'll come out and be like, yeah, we're going to steal their oil. We're taking their oil. Or yeah, we're doing regime change. We're changing the regime, they say. Yes, we love war. We hate healthcare. We have to fund war. It's just so I appreciate it sometimes. I really appreciate it. Another like honest thing that Trump did was renaming the Department of Defense to the Department of War. That is one of the things that he did that I loved because it's honest. It was never the Department of Defense. We are always the Department of War, the Department of Offense. Anyways, let's watch this video here, and it really just lays everything out that like almost every politician in the country kind of just has like beliefs they hold. Yeah.
Don't send any money. Daycare. But we're fighting wars. We can't take care of daycare. You got to let a state take care of daycare, and they should pay for it too. They should pay. They have to raise their taxes, but they should pay for it. And we could lower our taxes a little bit to them to make up, but it's not possible for us to take care of daycare. Medicaid, Medicare, all these individual things, they can do it on a state basis. You can't do it on a federal. We have to take care of one thing, military protection. We have to guard the country. Don't send.
What else can I say? That is the most honest take on the American political system and just how America has been since its inception. It's crazy. This is the most honest thing, most probably factually accurate thing that Trump has ever said. Not that he's right that the federal government can't pay for these things, but just the fact that majority of our government would rather fund war than fund daycare, fund healthcare. I have a few studies here that I actually wanted to show you real quick about if you like actually cared about saving money, saving the country money and improving the country, you would move to a single payer healthcare system. I have 3 studies that I want to show you here. This one is from the National Library of Medicine. Let's just read the abstract here. Although healthcare expenditure per capita is higher for the United States than any other country. So, in simple terms, we spend the most on healthcare than any other country in the world, but we have the least desirable outcomes because we are one of the few countries in the developed world that doesn't have some form of single payer healthcare system, that doesn't have like healthcare as a human right and guaranteed to everyone. Over 37 million Americans are entirely without health insurance, and 41 million more have inadequate access to care. By the way, while we're going over these numbers, just know that this study, I'm trying to find the date here. I forget where it was, but I seen it earlier. Oh, right here. This was a study from 2020. So between COVID and Trump's massive cuts in the big beautiful bill to Medicare, Medicaid, and other programs, this is much higher. This is much, much higher. Whereas ongoing efforts to repeal the Affordable Care Act could exacerbate healthcare inequities, a universal system such as the proposed in the Medicare for All Act, MAA, has the potential to transform the availability and efficiency of American healthcare. Taking into account both the cost of coverage expansion as well as savings that would be achieved through the MAA, we calculate that a single-payer universal healthcare system is likely to lead to a 13% savings in national healthcare expenditure, equivalent to over $450 billion annually. The entire system could be funded with less financial outlay than is currently incurred by employers and households through healthcare premiums, as well as existing government allocations. This shift to single-payer healthcare would provide the greatest relief to lower-income households. Furthermore, we estimate that ensuring healthcare access for all Americans would save over 68,000 lives and 1.73 million life years every year. That is crazy. In other words, and I've harped on this before, but we have like 70,000 people in the United States that die every year due to lack of access to affordable healthcare. That's crazy. And I bet if you dug a little deeper, the numbers are way higher because you got to consider how many people just don't go for yearly checkups, or like they get a lump or they have a pain and they just can't get off work, or they can't afford to go to the doctor. They let that fester until boom, they're in an emergency room with 3 weeks to live. Uh, Moving on to the next little snippet I want to read here. This is from the University of California, San Francisco. Single payer systems likely to save money in U.S. Analysis finds a single payer healthcare system would save money over time, like even during the first year of operation. According to nearly 24 analyses of national and statewide single payer proposals made over the past 30 years. The study, published Wednesday, January 15th, 2020, comes as California Governor Gavin Newsom has named a state commission to find ways to achieve universal coverage, possibly through a single-payer system, and as the Democratic presidential candidates are debating Medicare for All proposals on the national stage. Remember, this is from 2020, and I don't know if this was before or after Gavin Newsom vetoed a Medicare for All bill in California. If that's just one reason why you should just pray to God that he is not the Democratic nominee in 2028, that's one of them. These analyses were used by policymakers to evaluate the proposals, estimating savings the plans would create through simplified billing and lower drug costs, while also taking into account increases in health spending that would arise as newly insured people sought health care. The researchers that found 19 of the 22 models predicted net savings in the first year after implementation, averaging 3.5% of total healthcare spending. The researchers were able to estimate longer-term savings by using cost projections made in 10 of the models, which looked as far as 11 years into the future. These studies assumed that savings would grow over time as the increases in healthcare utilization by the newly insured level off, and the global budgets adopted by single-payer systems helped to constrain costs. By the 10th year, all modeled single-payer systems would save money, even those that projected costs would initially increase. And then last one that provides some decent points. We can't afford not to implement Medicare for all. Our healthcare spending is estimated to continue rising and reach nearly $6 trillion by 2027. That means, according to the federal government, we will spend around $42.9 trillion on healthcare over the next decade if we maintain the status quo. Medicare for all will cost less than our current system. A recent study by Yale epidemiologists found that Medicare for all would save around 68,000 lives a year while reducing U.S. healthcare spending by around 13%, or $450 billion a year. That was the same study that was referenced in the .gov article. Medicare for all spending would be approximately $37.8 trillion between 2017 and 2026, according to a study by the Political Economy Research Institute at the University of Massachusetts Amherst. That amounts to about $5 trillion in savings over that time. These savings would come from reducing administrative costs and allowing the government to negotiate prescription drug prices. Other studies by think tanks and government agencies have analyzed single-payer proposals at the state and federal levels. Most found Medicare for all would reduce our total healthcare spending. Even a study by the Koch-funded Mercatus Center found that Medicare for all would save around $2 trillion over a 10-year period. So we have a wide range of numbers and studies, and the overwhelming majority of these studies show that you would save money, and not only save money, you would have better outcomes. People need to understand that not having like a single payer system or like a universal healthcare for everyone, this is an abnormality. This is not a normal thing in developed nations. Almost every other developed nation in the world has some form of public healthcare system or single payer, public-private kind of partnership. But at the end of the day, healthcare at the point of access is free or very, very low cost. And if Democrats wanted to go on if they wanted to sweep the next election by 50 states, they would just be bold and they would actually fight for something like a single-payer healthcare system, a livable minimum wage, housing for all, a massive infrastructure projects. And even Trump code it. Like, what I think would be the perfect formula to just sweeping an election, is running on those policies that actually are very popular among Democrats and Republicans, much more effective, and in many ways will save you money. It will improve the economy greatly. It's going to uplift so many people. If you can do all that while Trump code it, by Trump code it, I mean just come out and be unapologetic. Just let any criticism just water off a duck's ass. Go immediately on the offense to anyone who's like, how are we going to pay for it? How are we going to pay for it? Immediately go on offense. Go on offense. Like, if you literally had a Trump that was advocating for progressive policies, oh my God, minus like the pedophile stuff. But if like, oh my God, it would be a 50 states easily. Every single day it comes out like what the voters want, what the Democrats' own base even wants, and every day they're like, let's become more centrist or move even further to the right. That's going to win us elections. So annoying, man. But yeah, single payer system, and it's a no-brainer. And like, to anyone who's like, how are we going to pay for it? Or you realize it saves us money. And other countries who are not the number one economy in the world are paying for it just fine. And not only are they paying for it just fine, we have much more freedom being the number one economy in the world. And with the, at least right now, US, the dollar being the world reserve currency, so we can debt spend like crazy, there's no reason why we shouldn't have nice things like a single payer healthcare system. There's just no reason. And to anyone who's like, oh, the wait times are already long. It takes months to get into certain specialists depending on where you are. If you're concerned about that, great. I am too. So let's also do federal subsidies and in a grant program to fill in the important sectors of our medical field to make sure we're prepared. Pay for more doctors to be trained and educated. Like, there are ways to address that instead of being like, well, you know what? We just shouldn't do it at all. We should continue to let 70,000 people a year die from lack of inadequate healthcare. Anyways, that's all I have for this one. Let me know what you think in the comment section down below, and I will see you in the next one. If you made it to this point in the video, I just want to give a special thank you. If you enjoyed it, please hit that like button down below. And if you really enjoyed it, maybe consider hitting that subscribe button while you're down there. I want to hear your thoughts in the comment section. I will try to reply to any and all comments that I can. Until next time, watch that video on screen.